you're speaking with François Allians from the Netherlands. I was already here in China with the doctor for a second opinion, and you guys could see me at YouTube. But now I'm here in the hospital with the doctor because now he has done my operation, which was needed. And yeah, the operation was very good. You can't compare the prices with, for example, the prices from here in India are very much cheaper than the prices in the United States. In the United States and Europe, they ask outrageous prices. For example, for a knee type like mine, they could ask you $50,000 for the same operation, which is also done with navigation. My doctor has done the total knee replacement with extended with computer navigation, which is a little screen which the doctor exactly can see how much varus or valgus he needs to put the oxygen knee in your body. So it's going to be exactly straight in your leg and not a little bit not like this or like that. It's very important that the knee is going to be straight in your body, because when it's going to be a little bit like this, then there's going to be a lot of wear, or at the inside or at the outside, and then it wears and then it wears, and you're going to have a big problem. No, and in this case, this can be happening because I've seen with my own eyes the X-rays, and really the prosthesis which doctor have given me looks perfectly straight. He has really outdone himself on my, because I'm a special case. It really was a very complicated operation. As for it needed some attention from a surgeon, which really treats you good. We treat you like a human being and a person. And the only thing which he wants is that you come good out of operation, that you go back, that you can go back again to do your things which you always wanted to do. At the Capital Healthcare System, you get more personal care. The doctor really looks at you that you're okay. He comes in after operation a few times to see if you're okay, and yeah, it's completely different than the other healthcare system. And if I can recommend it to the other patients who are now suffering and not are satisfied with the orthopedic surgeon, it's better to go to Dr. Van Kattershelm, because yeah, he treats you like a person, and because he works with a completely other healthcare system, he can treat you more like a person. He gives you the attention which a patient needs. For example, at the moment, a total knee replacement, which is something we needs much attention. This same attention in Europe and the United States, sometimes they like to do, because they say it's only operation for 1 hour and then next patient. That's not what we want. We want to be treated like a person, like a human being. It's our human body. We want to have it normal, and not that orthopedic surgeon gives me the knee replacement if it was something normal, and then they put us, and then they sent us back at home after 3 days. No, that's not possible. After 3 days, not. Here, for at least you need to stay a certain amount of time that the doctor sees that you are recuperating, being good, and that he so that you can, when you leave this hospital, you can have it in mind that you're going to leave well, and not with certain doubts or something like that. The other doctors in Europe had elected to do that because they are working for a total different healthcare system. They work on the socialistic healthcare system. They work for the government. They don't mind which patient they get in front of them or what type of disease that they have. They can do whatever they want because the government decides. I've already had so many surgeons in Europe, and they say all the same: wait until you're 50. I came to Chennai to see Dr. Van Kattershelm, and I had a good talk with him, and yeah, he really was seeing that I was suffering of the knee arthritis and that I was depressed, etc. And he didn't hesitate to help me. He treats me like a person, and not like a number, like in Europe or In some other parts from the United States, they also treat you as a number, because in Europe and in United States they work with the same socialistic healthcare system, and the doctor works with the capitalistic healthcare system. That is completely different. You can't compare those two things.